Madison, welcome to the show.
Thank you, Elon. Thank you for having me.
Yeah, so Madison is a medical scribe and she just got into Penn State. So congratulations.
Thank you.
And when did you decide and when and why did you decide to become a medical scribe?
Yeah, so obviously I did my 4 years of undergrad. And when I got to the point where I was like, okay, I know timeline wise, I'm going to apply to medical school the end of my senior year. That meant I would have a gap year before starting med school. So then I started to brainstorm, okay, what can I do during my gap year? Can be both productive and prepare for med school, but also kind of have some free time and relax, recharge. So I had a friend who than me doing the same pathway as me, and she was a scribe at a cardiologist's office, and she told me that she really enjoyed it. She learned so much about cardiology. She was originally into OBGYN, but through her scribing she changed her mind and was like, actually I want to be a cardiologist. So I just knew like, okay, this is something that's like really beneficial to do. So I applied for a local urgent care to be a scribe because I wanted to more so do general things and learn about, the whole body, not just a specific specialty. So applied for a scribe at an urgent care, and yeah, mainly just wanted to get exposure into different kinds of conditions, sicknesses. Medications was a big one. I was not literate at all in medications, so I've learned a lot since becoming a scribe. And yeah, just you're working side by side physically throughout it, so it's almost like built-in shadowing too. And yeah, I just knew it's probably the best thing to do to prepare for medical school.
Yeah, and do you think it's compared to like being an MA or another one of those entry level jobs, like do you think scribing is better than them, or do they have like pros and cons, or what do you think?
Yeah, that's a great question. A lot ask me, especially when they're deciding what to do for their gap year. There's definitely pros and cons with both. For an MA, you have to do about a year's worth of school, maybe sometimes less. There may be some like 6-month programs. For the program, you have to do a lot of schooling, and then you can become an MA. And me only having one gap year, and people usually only take 1 or 2 gap years, that's kind of very time consuming. You just want to start right away. So the benefit of scribing is you don't need really any training or schooling at all. You just get the job and, kind of start. So that was a big factor for me. But then also now that I've been a scribe and I work with MAs, so I see both sides of it, I realized that yes, MAs have more hands-on patient interaction. Like they'll draw blood, they'll do COVID swabs, they have more hands-on stuff, versus as a scribe, you don't ever really touch the patient. But I would say I definitely learned significantly more about medicine and what it's like to be a provider as a scribe versus an MA, because the MAs don't really work side by side, the providers, as us scribes do. And we really are kind of like their brain in a sense, like whatever the provider says, whatever they're thinking, we have to know so we can jot it down. So it's the best way to really get inside the brain of a provider, see how they're thinking, see why they do what they do, why they prescribe what they prescribe. And so overall, for the many different benefits, I would say scribing is probably more beneficial than being an MA. An MA would be really great for like nursing school, I would say.
Okay. Yeah, so they just have different utilities in learning what to
Mhm.
do or how to do it. Um,
Yeah.
yeah, and what's the hardest part of being a scribe?
Yeah, so I would say the hardest part, I mean, sometimes, like with any job, you can work with difficult people. Not that I personally have experiences with that, but just in general, like, clinics get really busy. It's long hours. So as the day goes on, people may be a little less, in a good mood, maybe have a little bit less patience. And yeah, so I think sometimes like the long hours for sure gets you, like we work 12-hour shifts. Other places may be different, but from my experience, it's 12-hour shifts. Some clinics can get extremely busy, like 50 patients in a day. So I would just say like, Yeah, just kind of the labor of it sometimes on those busy, long days. It can get very tiring. You're on your feet the whole time. It's almost like a physical demand, honestly, but that's good to still get used to before medical school and becoming a physician, because there's always going to be those long hours, even overnight shifts too. And there is that aspect to becoming a provider that people don't always think about. So I would say the physical demands can sometimes be the hardest part. When it's a long day, you're tired mentally, it's hard to think. Maybe the provider's getting a little less patient with you, but it's just about taking it one patient at a time.
Or even less patient with the patient, right? They're coming in like
Yeah.
later in the day, and then it's like they're just about to close and somebody comes in and is like, actually, I have like some eye redness or whatever. And that's frustrating for like everyone involved, you know?
Yeah. Yeah, definitely. Because, 12-hour shifts, we can actually go on to 14 hours I've done before, because we take patients until the last minute, and sometimes it's just so busy. So, yeah, I've definitely had 14-hour days where it's like nonstop the whole day. And it can be a lot. But like I said, it's good training, and over time you get used to it.
Mhm. That kind of piggybacks into the next thing I was going to ask is like, what do you not enjoy? Because you said you enjoy like learning, being with the provider,
Mhm.
kind of getting into their head, learning about the medication and stuff. But what's something that you don't really care for?
That's a good question. I think I really love patient interaction. Like, really, like that's one of the main reasons why I want to be a physician, is I just really love people. I love interacting with people. So I think if you don't put any effort into trying to talk to the patients as a scribe, you never really need to, besides maybe just a simple question like, what pharmacy do you want me to send this medication to? Other than that, there's really no need to talk to the patients, and there's never a need to really do anything on. So I would say that's the downside, but I think there's ways to get around that. Like, I'm very social, so I still try to find other ways to talk to the patient, even if it's just like, oh, how's your day going? Or, just like, I don't know, casual things. If they came in with a, foot injury, like, oh, did you play sport? What sport do you play? So I think there's ways to get around that. You just have to put more effort in. And even with the hands-on, like some providers will let me use like the otoscope to look inside a patient's ear if they give consent to me doing so. And I think you just have to put yourself out there a little bit more, ask the provider like, oh, if there's ever anything I can do, let me know, or, just strike up a conversation with the patient. So it's not like part of our scope of practice per se, but you can still try to get around it and get as much of it as you can.
Yeah, and that's a good rule of thumb just in general. You got to put yourself out there so that you can see,
Always.
like, yeah, who would take you to shadow or who would
Mhm.
like I don't know if you're applying for a different job at a scribe, just if somebody knows somebody, you can go there. Like it's just it's part of being a pre-med and stuff.
Yeah, absolutely. Like, definitely, I've been shadowing or even just like volunteering in hospitals, and like a doctor will walk by, and I just like walk up to them, and I'm like, oh, hi, like if you have any interesting cases, I'm a pre-med, like, could you let me shadow you? And doctors will never turn you down. If they see an eager pre-med, they will never turn you down. So that's definitely the biggest advice I probably have for pre-meds, is really just put yourself out there and create opportunities for yourself, even if they're not like in your face.
Hmm. And like who's gonna deny like a college student like that's interested in your field like the opportunity to teach. If somebody's there to learn,
Definitely.
that's a big
Yeah.
part of like residency is just teaching people. So they
Yeah.
gotta they have to like it on some level.
Definitely. There is a huge part of teaching within medicine. Every doctor has had to, pass the baton and like pass their knowledge to the next generation of doctors. So they're very used to it. They're very comfortable. A lot of times they really enjoy it. It kind of resparks their own passion in medicine. Maybe they were having a tough day, but an eager pre-med coming up to them like actually gets them excited.
Mhm. And yeah, that's creating opportunities for you. Just everybody wants to know. Yeah.
Mhm.
So do you have any interesting patient stories? Someone that you'll never forget that walked into the urgent care?
Aw. Yeah, no, there's been a lot of patients. I've seen like honestly thousands and thousands of patients at this point. So you see the good patients who are really nice. You see the very frustrated patients. I can definitely or two. Let's start off on a good foot. I would say the most memorable experience I have, and like this is something I have even told in like med school interviews and stuff, but and this just like I'll connect like why I'm telling this story afterwards. But there is a special needs patient who came in to the clinic one time, and she just had like standard symptoms like sore throat. I think she was prone to getting sick, getting strep sometimes. And she came in. We didn't know she had special needs at first. We just saw on the chart like sore throats. We're like, okay, easy case. So me and the provider walk in, and then we see the patient's very, very severely special needs. And we're like, okay, like let's just start the exam. So we, the provider starts to try to look into her throat or look into her ears, and she was not having it. Like she was very scared. You could tell she was, like screaming, she was crying, she was, throwing her hands up, like, don't touch me, don't touch me. So it was a tough situation. The provider like literally could not do the exam, but it was something that like we needed at her, make sure she doesn't have an ear infection, see how red her throat was. Maybe it looks like strep. And these are all like, important things we need to see. And it was tough. The special needs patient, her father was there and was like trying to calm down, but it wasn't working. It was very much like, okay, what are we going to do? And as like a scribe, I'm, just kind of standing in the corner taking my notes on the laptop, but I knew like, okay, like this is something I need to step in and try to help out, like just do whatever I can. And I saw the patient was kind of like reaching out to me a little bit with her hand. So I just took the initiative. It felt right. I stepped forward and I like grabbed her hand and I was holding on to it. And she like immediately calmed down. It was literally just so like calm. It's just like by holding her hand, that was like all she needed. And she stopped, and then the provider was able to do the exam. We saw what we needed. We could prescribe her the right medication. And I just remember forming this connection with the patient. She was just so happy. Like she ended up developing a smile on her face, and overall like left the clinic having, a much better attitude than she did like coming in, just from a simple act of kindness. It, took away her fear. And that's something I will never ever forget. Just like, no matter where you are out, you don't have to be a physician. You could be a scribe, you could be at any position, and you can always play a role within patient interaction and patient experience. That's so important. So I just really learned a lot that, it's not, I'm just a scribe. I used to say that a lot, like, oh, I'm just a scribe. And it's like, no, it's not just a scribe. Like we're all part of the healthcare system. We all play a role. And the main goal at the end of the day is to give the patients the best experience they can get. So I would say that was something I will never forget. And, just a little inspiration to, always step in whenever you can, try to help out, look for those fears within patients and try to, make their experience a little bit better. And I know that was a long story, so maybe I'll just tell that one, but that was definitely the most memorable. So I had to start off with that one.
Yeah, that's good. That's what medicine is all about, is trying to
Mm-hmm.
form that connection, make them feel comfortable. And, like this scary thing, even going into urgent care, just getting your ear checked. You have no idea what they're going to find. So
Yeah.
just even that little bit of comfort goes a long way for everybody, not even a special needs child, just even like an old lady
Mm-hmm.
who's scared to go to the doctor because she's been just bombarded with tests and things that they think are wrong because she's older, but they are not. So yeah, that's
Yeah.
a really great story.
Yeah, that was a moment where like I knew like this is something I'll never forget. And it was even longer in the moment, it was a lot of like me and her kind of started like talking a little bit during it. And it was just a very special moment I'll never forget. And like you said, it could be anyone. Like you'll see that's probably the biggest thing I've learned from Scribe, just like, the medicine side of it, but it's really the healthcare side of it. and patients of all ages come in and from all different backgrounds and all different experiences with healthcare. Like some people come in and from the second you see them, they're already in, more negative headspace, maybe very less, not a lot of patience. Maybe they're a little snappy with the provider. And like at first glance, it's kind of like, oh geez, like, why are you like this? But then when you stop to think about it, it's like, well, maybe they had a bunch of bad experiences in the past that, the way they see doctors, the way they see, doctors' offices. And it's tough. You really have to keep in mind that, people have different experiences that have shaped them, and you can never judge when you don't know. And you really have to give every patient you have the same quality of care, the same understanding, and just kind of, I don't know, always look for what may be going on the deeper level than just like the physical health.
Yeah. And that's a hard thing to learn or like in medical school, or in residency. If you haven't had that extensive patient interaction, you don't really know how to deal with people, which is the whole point of medicine. It's just, you have to treat people. You're not treating like animals. Like if you're a vet, you're not treating like the tree outside. It's a person. This is their life. This is,
Yeah.
They don't have a second.
Absolutely.
So let's talk more about your undergrad journey, right? You transferred from community college. That's not something that many people do. I mean, many people do it all the time, but applying to medical school is a little bit less common. So how was that process for you?
Yeah, so I live in Southern California. I live right outside LA. So from a child, naturally, it was my dream to go to UCLA. And I applied out of high school. I worked really hard throughout high school, a lot of AP classes, like graduated with 4.3 GPA. But I didn't get to UCLA, and I didn't get into a couple other UCs as well. And that kind of left me with a position of like, oh, wow, like, what do I do? And I do have a college called Moore College. So I just decided, like, you know what, I guess this is kind of my only option. I really only applied to a couple schools out of high school, and I didn't get into any of them. So I was left with the community college route. But I am a massive, massive advocate of doing this transfer process now, even as a pre-med. Like, yes, it's a little more tough, but it was so worth it. Like, I really enjoyed my 2 years there. And, going back to the whole creating opportunities for yourself, like, yes, there's limited resources at the community college school, but then that also just means there's a lot of room for growth. And my campus didn't have any sort of medical club whatsoever, no medical club. So I decided to take the initiative, and I started the pre-med club on campus, and I was president of that. And that was just such a great leadership experience. I learned a lot. I got outside my comfort zone. And that was, a big part of my application for medical school. Is like, I didn't just join this club, I started this club. And I created those opportunities for myself and for my fellow classmates that wasn't there originally. So I think that was really great. And yeah, just really enjoyed my time. It's a lot easier to connect with professors there. So I got like some really great letters of rec. But, ultimately, I was able to transfer to UCLA after that. So that's where I did my last 2 years of undergrad. And I just thoroughly enjoyed my time at UCLA. Like, it was such a great experience. And I think I really needed that growing period at community college. Like, I stepped outside my comfort zone way more than I did in high school. So once I got to UCLA, I felt very prepared, very comfortable to, join more clubs on campus and join research and, really excel in my classes. And I think it was a really great growing period that for me was much needed, and maybe other people as well. And I joined a lot of transfer clubs on campus, became a big transfer advocate, and that was a large part of my application for medical school. Something I was very proud of. I got a lot of community experience through my transfer clubs on campus, a lot of community engagement and leadership, mentorship for sure. So that was something that I just became very proud of and kind of made it my thing. And I think that goes to show that everyone's pathway to medical school looks different, but there's an advantage in it looking different than other people's. You can, really use that to add to your story. And I think we shouldn't be so narrow-minded into like what we should do and what the path. I think you can broaden your horizons a little bit, do what you want to do, or maybe turn something that started off as a negative into a positive. And that's just my biggest advice with that.
Yeah. And because you were at community college, you didn't have like a medical school attached to it. You didn't have like
A
physicians coming in.
hospital.
Yeah,
Yeah.
anything like that. So how did you find that kind of community with the doctors and shadowing and all of that stuff?
Yeah, so then those 2 years I was at community, I did start the pre-med club, like I said. So that was like me getting leadership and kind of community engagement. Starting the club, I was able to reach out to current medical students, like at UCLA and nearby schools, to do like Zoom presentations to us about like the MCAT or about, applying to medical school. So I just try to like reach out to people, connect through them. Social media really helps with that. So I got a lot of guest speakers or like maybe did my own presentations. So that was really helpful. So that crossed off like, the leadership box, but you should always do things you want to do, not just for like checking off a box. But, that's where I was still able to get some leadership experience. And then, yes, the school wasn't attached to a hospital, but like, almost every city has a hospital. So I just went through the COPE Health Scholar program at my local Advanced Health Hospital. And that was like a really great program. I got 300 hospital volunteering hours through that. And that was where I was saying like, I'd just walk up to physicians while I was there, even though it wasn't part of me being a volunteer, but I'd just walk up to them and say like, oh, hey, like I'm a pre-med student. I shadow you for the day. And they always said yes. So I made a lot of connections through that. Actually got some letters of rec through that. So that's really great. And then not too much research, unfortunately, on campus. I think I did one like minor research project, but mainly my research came once I transferred. Limited what you have at the community college level compared to university, but I think it's just a great opportunity for growth and leadership and really discovering what it is you want to do. And then once you do transfer, like you just have so much drive to like start right away, make the most out of the 2 years you have there. And I really found myself and my fellow transfer students, we were much more motivated than any people at UCLA that had been there since freshman year. Like by junior, senior year, they were burnt out, they were done. But like we were like coming in fresh. We were so excited. We were taking advantage of all the opportunities. So I really noticed that like me and my fellow transfer students probably kind of ended up being more successful in the end, at least those last 2 years. Just something to consider.
Yeah, so you're glad that it worked out in the end. You didn't get into, I mean, that's kind of a weird way of saying it, but you're glad that you didn't get into any of your schools after high school.
Yeah, it is a weird way of saying it, but in a sense, yes, I'm extremely glad. I just feel like upon reflection, the person I was after going through community and entering UCLA junior year versus, how I would have been entering freshman year, I know like I probably made the more out of the 2 years I was there than I would have been able to out of the 4 years I was there, just because I grew so much before. And it's really important. And yeah, just with everything in life, everything happens for a reason, it really does. And like I said, I wouldn't have this strong transfer community that I do now if it wasn't for that experience. So everything happens for a reason.
Yeah, that's really good. And do you want to elaborate on any other specific things that you did that you think helped you get into medical school or something like that? Like you talked about the pre-med club, you could,
Yeah, definitely. So when you apply to medical school, you have 15 activities you can talk about, right? And I filled all 15 of those. So I definitely, going into undergrad, like I knew right away, like I want to, go to medical school. And I kind of, from freshman year, made sure I was, being productive and getting involved in extracurriculars. So I do have a pre-med club I started at my CC I was president of, but after transferring, I then joined another club that I became president of called Transfer Med. So it's like pre-med club, but for transfer students at UCLA. So essentially the same thing. But you know, it was a really amazing experience. And then I joined like a other transfer club that like we held a lot of like mentorship events for current community college students looking to transfer. So mentorship's big. Like you definitely want to have something mentorship related or teaching related, maybe like a TA or something. It's always good to kind of have the experience of guiding others and giving back to communities. They definitely want to see some sort of element of that on your application, because as a doctor, like you're giving back to communities through health. So not that you had to have done it through health in undergrad, but you should have done it in like some sort of way that you can connect it to medicine. So I did so through, you know, panels I would hold for community college students, mentorship events, and Q&A panels. So I did a lot of stuff through that. And then I did research. That's a big one. So some people say like, oh, you don't have to do research to get into med school, but it's not something you want going against you, because like 90% of people applying will have research. So if you don't have it, it is, you know, just something that could be used against you. And I didn't want anything against me, but I did research for 2 years at UCLA. That was a really great experience. I even got a research minor while at UCLA. So I did like a lot of presentations and posters and a lot of learning about research, which is really important for medical school, because you need to, you know, there's a lot of new data on like treatment plans and different conditions. So it's important to be able to stay up to date on current research findings and maybe even be able to apply it to your current patients. So it's extremely important to be like research literate as a physician. Those were some of my big ones. Let's see, obviously shadowing. I had like over 100 hours of shadowing, and I did a couple different specialties. So I highly recommend that. So you don't want to just seem narrow-minded. You want to, you know, look at as many specialties as possible. Ideally, like for sure at least 2, if not like 3. I also recommend shadowing maybe a PA or an NP, just so when they ask you the question like, oh, we know you want to go into medicine, but why do you want to be a physician specifically? You can say you have like experience shadowing many different kinds of providers, and you know that, you know, for reasons XYZ, you want to be a physician, not, you know, a PA or an NP. So I think that's important. So I did shadow 1 PA. And then hospital volunteering for sure. You can go to really any hospital. They usually have some sort of volunteer program. And then I would say as well, community for sure. Like, and this could be in anything. It doesn't even have to be medicine or healthcare at all. This is where you should really get the most creative, do what you're genuinely passionate about. But community service and giving back to others is like a big, big part of the application as well. I know that was a lot, but the application is a lot. So hopefully that helps.
I know that like PAs and NPs, that's something that medical schools really want you to differentiate from, because you could very easily just become a PA and do very similar things. So how did you, on your application, try and differentiate that, saying I want to become a physician, not a PA or an NP?
Yeah, so I mean, that can look different for everyone, but for me, like, it really helped shadowing. I shadowed a dermatology PA and then a dermatology MD. And that really helped because I saw the PA is still doing a lot of biopsies, still, you know, leading the conversation with the patients. Like a lot of times the patients wouldn't even ever see the doctor. They only see the PA. So I definitely knew like, okay, PAs have a large scope of practice. But what really did it for me, so I'm into derm and I want to do Mohs surgery. And it was like the PA would yes to the biopsy, but if it came back cancerous, then it was like the PA's job was kind of like done at that point, and the patient was passed over to the MD, who would then go ahead and do like Mohs surgery to, you know, fully remove all the cancerous cells on the patient. And I just knew like, through all of the leadership experience I had throughout undergrad, I really like being like kind of, the head of something, in charge. I don't like passing off duties to other people. I really like to be the one doing it myself. And like I said, I love people. I think patient continuity is the phrase I usually use. Patient continuity is really important to me. I don't like the idea of passing off my patients to other people, even other specialties too. I really like to get to know my patients at the very end of treatment, when they're all better, they're all cured, hopefully. So I think that was just something I noticed. I didn't want to ever like pass my patients off to someone higher. I just would rather be in that higher position doing it for the patient myself.
Yeah. And would you say just in general, you're more drawn to that like longitudinal style of medicine rather than something like surgery, or even like something quick outpatient, like an internal medicine or something?
Yeah, I would say for me personally, obviously different for, every single pre-med out there. But for me personally, I definitely like the specialties versus having to pass someone off specialty. I just love having maybe that, extra time to really get to know someone and help them through like the final steps of their treatment, and hopefully send them out the door. They don't need to go see a different doctor after, hopefully they're all better. I think that is something very important to me. But it's different for everyone. So I meet a lot of people who say like, rather just like bye, like, push them out the door, like, okay, so that's someone else to deal with. Like,
Mhm.
which, hey, that's fine. I think it's changed, but I think right now I definitely like prioritize interacting with my patients as much as possible. So I'm drawn to
Mhm.
specialties that are able to do that.
Do you have one like specifically? You mentioned derm, but is there anything else that you were
Yeah.
considering?
Yeah, so I've been interested in derm my whole life, because that's kind of where like my interest in medicine really resonated through personal experiences. So for sure, dermatology is something I'm very interested in. But going into med school, like Elon said, I'm starting med school in about a month, literally a month. So I had to look at the date. It's getting real. So yes, I start Penn State College of Medicine in 1 month, and definitely, even though I've always been interested in dermatology, I'm going into it with the absolute widest mind possible, like open to anything. I'm excited for all the rotations I'll eventually be doing, and learning about, all different systems of the human body. And I think, being a scribe in an urgent care and an emergency room actually this past year, I definitely realized like, dang, I really love the whole body. Like, I love medicine. So I'm interested to see if maybe change at all to like ER or primary care or internal medicine, something that allows me to stay, connected with the whole body rather than just something that's like, specific like the skin.
Mhm.
But I don't know, like I've said like 5 minutes ago, like I do like, being a specialty and being with my patients till the end. So I think there's pros and cons, and that's why it's best to just like go into medical school with your mind wide open.
Yeah. Do you want to talk more about being a scribe in the emergency room?
Yeah, so I started off as a scribe in an urgent care, and that's where I mainly do my work. But I also have had the great opportunity of working in an emergency room as a scribe as well. So there are some differences. I mean, obviously, like we see
Yeah.
a lot more life-threatening cases, and just learning a lot more. I would say like this experience has been really, really good. Um, and even with the hands-on, like in the urgent care, the few times I've gotten to be hands-on, it's like looking inside a patient's ear to like see their, infected TM. But in an ER, my hands-on has been doing CPR on an actual patient. So there's big differences there. That's why I think it's always good to see as many specialties as possible, because then you much as you can. So I would say it's good to maybe start off in the urgent care setting. It's a little bit more calm there, obviously. So that was good to like really hone scribing skills, having more time to really make sure I'm taking in-depth HPIs, and I'm really learning about the medications, learning about different conditions people have and how that affects the action of treatment you do for them. or maybe like what medicine you prescribe them. So I would say the urgent care was really great for setting like baseline knowledge of like kind of the way providers think, approaching each and every patient. But then the ER was great for just like seeing so many cases I would have never been able to see in the urgent care, and then obviously learning about those cases. And yeah, so I would say both. I've gotten to learn unique things in both settings.
Yeah. Do you want to talk specifically about like how you fill out a patient chart, like either in the urgent care versus in the ER, but like just if you don't mind going into some granular detail about how all that works.
Yeah, definitely. So this will pretty much be the same for any like clinic you work at, but there's this whole, it's called like, and it stands for subjective, objective, assessment, and plan. And that's
Could you repeat that
essentially
again?
why. Yeah. Oh, yeah. SOAP. So the SOAP, the S is subjective. So like the patient's complaints. The O is objective. What the like provider sees objectively. And then A is assessment. So kind of like everything you do during the exam, like any treatments you do or whatever. And then P, plan, is like, okay, we're going to prescribe them this. We're going to tell them to watch out for these signs, or go to the ER if this happens, or, just like the plan of action for the patient to take after leaving the clinic. So that's kind of like the format of every single patient chart you'll be filling out. And then, depending on where you're at, what system to use, what's all, like, it can look a little bit differently, but it's all going to check off all 4 of those topics that I said. So the subjective is where your HPI, that stands for history of present illness. That's basically just where you're writing down as fast as you can, like everything the patient says, and then trying to like cohesive and like make sense, of course. But that's where you have like your 28-year-old male with past medical history of hypertension and type 2 diabetes presents with chief complaint of heart palpitations for 1 week. That's kind of like the standard first sentence. And then you go into like the story. The patient says like, oh, I noticed 1 week ago when I was falling asleep, my heart was rapidly beating and felt irregular, but then went away until it started again yesterday. Like, whatever the patient says, you type. So that's kind of like the first thing a scribe does. That really helps the providers, because obviously when you're a physician and you're worried more so about like taking care of your patients, having to write something like that just kind of, it's like not a waste of time, but like probably feels like it when you're just like constantly typing up patient stories. So that's probably one of the biggest benefits of scribes, is like writing that. And then you also document then during the exam. So this would be the objective part, the exam, like, oh, their throat was red, their ear seemed infected, they had a rash on their forearm that was, I don't know, 10 centimeters wide, or, I mean, that'd be a pretty big rash, but, you're just like documenting like what is done during the exam, what is seen during the exam with the patient. And then after that, any sort of treatment, like sort of COVID tests or nebulizer treatments, or maybe there's a cyst and you need to drain it, document, of course, like everything that happens. And then you come up with the diagnosis. So you work with the provider with that. What's the diagnosis? What's the medication going to send them? And then what's the plan? If they have a broken foot or fractured foot, you're going to say, I advise them RICE therapy, which is just rest, ice, compress, elevate. So just like what you recommend to the forward. And yeah, so you're really like doing everything start to finish from the second the patient gets there to when they leave. And these are all things that the providers go through in their head when they're treating a patient. So you're really, documenting every little thing. So you learn a lot about just, yeah, what the mindset is like being a provider.
And yeah, I mean, it's really great because you really are doing what, like, they're kind of half their job. Like, they do so much charting, and you're just taking that off of them. I mean, first of all, that's got to feel good. But second, you're just like, people go to school to learn how to put that, like, put what to put down in there, and you're just doing it from a couple of days of training or something like that, you know?
Yeah, yeah, it's been really great. I will say, like, I highly recommend scribing as probably one of the best things, if not the best, you can do to prepare for medical school. Um, I know other people who were scribes before me and have, now already completed their first year of medical school, and they tell me, like, oh my God, the people who were scribes were way ahead of people who weren't in their class at medical school. And I've had numerous people tell me that. So I definitely feel like it is the best thing you can do for medical school.
Yeah, that's really great. And having scribed in multiple specialties, do you think that like changing your specialty that you're scribing for changes a lot? Like if you're working in a cardiology office, like you said previously, or like a surgeon or an infectious disease guy or someone like that, you know? How much do you think that would change?
Yeah, I mean, I think the general outline will always follow that guideline. So that will always stay the same. It's just like depending on what specialty you're in, depends on, the kinds of cases. So you'll obviously learn more about the specific conditions and medications and treatment plans for that specialty you're doing. But overall, you'll be following outline that I like went over with the SOAP process. It'll always be in like every patient chart, no matter what specialty you're doing. But obviously, you'll be seeing like different patients with different, chief complaints as to why they're there.
Yeah. And a concern for a lot of people like you who are scribes is the rise of the AI scribe and how that's going to change the whole landscape. Do you mind? What's your opinion on it? Do you think they're a net good? Do you think, how is it going to change scribing or just medicine in general, in your opinion?
Yeah, so that's so interesting. That's something that I just found out about a couple months ago. So it's definitely very new, and some urgent cares are starting to use it. At first I was like not worried personally because I was like, okay, like I'm joining med school, like I'm only gonna be a scribe for a couple months longer. Like personally, like job security, I knew I was fine. But then I was just thinking, like looking ahead, I was like, wow, that would suck if scribes get replaced with AI, just because of like it's such a great learning opportunity for students. And the more we train our medical students, the better doctors we get and better for society, right? So I was like, dang, that's like really unfortunate that people will be losing out on that experience. But I actually talked to some people who work at an urgent care that do use the AI scribes, and they say that, like, yes, there's benefit in using it, like with any technology, like, okay, yes, it's faster, sometimes less mistakes, less pay on the employer's side, right? You don't have to pay the computer. So they say, like, of course, there's those standard benefits, but I just, at least the providers I talk to who use it say, like, scribes do not have to worry. Like, AI is not going to replace them. Obviously, I don't know how many years in the future we're looking into, but they still said some complaints about the AI scribe. Like, it's still new, it's not perfect, and everyone always appreciates like the people interaction side of it. Like, I don't think doctors really want to be working with computers and AI technology. I'm sure like every provider would rather have a person in the notes, like as long as they're, doing them correctly, of course.
Yeah.
There's just always something that like technology will never be able to replace with humans, and it's just the human experience. People, healthcare is very stressful. So even just being able to have someone by your side to get through those long 12-hour shifts. So I don't think, at least in the next several years, I think people have to worry about like AI scribes fully taking over scribes. But I mean, yeah, just something to be mindful, make sure you'll just have to apply to certain urgent cares that don't use the AI technology, but it's not very many that use it right now.
And I was talking to one of my teachers, and he was saying that the benefit of using AI is because there's no embarrassment with the computer. Like if I go in and I have like a rash and like embarrassing place,
Mm.
no one's going to judge me. And I've seen patients who don't want me in the room because of an issue that they're having. So what do you think about that kind of aspect of the negative side of the human interaction, I guess, is the negative
Mm.
emotions that come with
Yeah.
it?
Yeah, I didn't think about that. I mean, yeah, of course, like, I mean, I don't know about like other people, but I don't know. I feel like a lot of people I know still get iffy with computers because of like the camera of it. And there's still like the audio part, it is like using audio to record everything the patient says. But I understand if like a patient would just feel more comfortable if the scribe was not there. And absolutely always, in the rare cases I've seen that always like we respected the patient's wishes. Like number one is always making sure the patient's comfortable. So I've definitely been in the room where patients had maybe, more embarrassing problem going on, and you could tell they were kind of shy about it. But if it was ever to the point where they did not want the scribe in the room, I'm sure every provider would be okay telling the scribe to just step out of the room, and then the provider will like give them like afterwards when they come back. So yes, like I get it, but there's also it's very easy to get around that. Like if someone really was worried about the scribe, a human scribe being there, like, always, make sure you're comfortable yourself, speak, have communication with the provider and just say like, listen, I'm like really embarrassed about this. I'd prefer if like as little people were in this room as possible. And the provider will respect that and the scribe will step out. So I do understand that point, but I think it's still pretty easy to get around.
Yeah. And even then, if like, let's say you like as a physician, you're thinking about that kind of aspect, it's because they're like a professional and they have like their white coat and maybe they have their scrubs on, like that kind of mitigates some of it because you know that you're being cared for by someone who's dedicated their life to this.
Mm-hmm.
So yeah.
Yeah.
And
Yeah,
you're
definitely.
gonna say something?
No, I was gonna say for sure, like, the white coat and help people make people feel more comfortable. I've definitely seen that. But yeah, I mean, um, yeah, the scribes are important, but if a scribe has to step out for one patient, the provider is perfectly okay with that.
Yeah. And I'm sure the patient is more than happy for that to happen.
Yeah,
um,
definitely.
let's go back to the ER. Do you have any interesting stories like from the ER? I'm sure there's probably too many to count, but
Yeah. Oh my God. The ER is crazy. Like I will say, while scribing in the emergency room, I definitely kind of found a love for it. Like I really do like it. I love that you treat, patients with all like literally anything could be wrong and they come in. So I really like how you become proficient, like really in the whole human body. I do really like that. Um, so yeah, I have a lot of experience or a lot of crazy memories. Like I was there. We thought this patient had meningitis. So that would have been scary if he did because it's very contagious, but we had to do a spinal tap on him. So that was really cool getting to watch the provider spinal tap patient. Thankfully it came back, he did not have meningitis, but for a second there, the lab actually inputted the results of the spinal tap incorrectly. Like they put in the wrong numbers. So for a split second, the physician I work with was like, oh, bacterial meningitis, which is like the most like contagious and deadly form. And we were all like, oh my God, like we would have had to immediately take like antibiotics and that would have been so scary. But thankfully, like we figured out like, wait, this doesn't seem right. And we called the lab and it came back and
that's
he did
scary,
not
dude.
have meningitis. But that was scary. That was a moment of realizing like, wow, like as providers, like you do put your health on the line, and not just providers, obviously nurse even more so, really. You do put your health on the line too. So that's something to take into consideration if you're considering this pathway. Not that it's common, and like we would have been fine. We would have just taken antibiotics and been good.
Mhm.
But yeah, I mean, especially during the COVID pandemic, I mean, thankfully, when I started being very active in like hospitals and shadowing, it was as the pandemic was ending. So I didn't, experience the craziness of it. But obviously, a lot of people did, and a lot of healthcare workers got sick, probably even died, maybe. So,
Yeah.
something to
What
consider, but yeah.
yeah, what stage of education were you during COVID when everything got locked down?
I was freshman year of college, so everything went virtual. So I was freshman, then it transitioned a little bit into sophomore year, but I was at community college during that time. So for me, it was, kind of worked out to where I was like, okay, like there's limited opportunities here anyways, and the things I am doing, I can still do virtually, like my club, versus like being
Yeah.
at UCLA. That would have been really tough because I can't be like active in my research lab during, if like everything's shut down for COVID. So I definitely lucked out on that end that it didn't really affect me too much at that community college during that and not UCLA.
Yeah. Okay. So, because I was in like middle school, so during that time, so like didn't really affect me too much. It was just
Wow.
kind of, yeah, it was just kind of a rough time. Yeah.
Yeah.
Do you and in the ER again? You probably see some patients that don't do as well as you would have liked them to.
Mhm.
How do
Mhm.
you deal with that? That's probably very, very difficult.
Yeah, I'm glad you asked this question because this was the next memory I wanted to say of the ER. We had a patient come in, or actually he was already in the ER. He was stable. He was going to be like admitted to the hospital, just like cardiac workup. He was a 90-year-old male, history of like, cardiac disease. And he was stable, he was fine. And then just like randomly, boom, cardiac arrest. He just like immediately coded. And we all had to jump in, like when someone codes, it's not like, oh, only their doctor and their nurse works on them. It's like, no, when a code's call, it's like all hands on deck. So, that was interesting. I have seen codes happen in hospitals before, but this was the first time I was like, could be a part of the resuscitation process.
Mhm.
So guy coded, we were doing CPR. We brought him back the first time, and then a couple minutes later he codes again. So we're doing CPR again, and it's very exhausting. We're doing CPR for a long time. So like the EMTs, the nurses, they had all like gone through their rounds taking turns. So when it got to the third time, like everyone exhausted and they're kind of looking around saying like, okay, who else can jump in and help? And since I'm CPR certified, um, one of the EMTs just turned to me and was like, hey, you want to jump in? And I was like, okay, definitely you have to take a deep breath because it's like, wow, this is serious. It's the first time I was asked to be involved in CPR. I'd seen it done a couple times, but it was something where the adrenaline was rushing, but I was still excited to finally get that experience. So yeah, I jumped in. I knew I could never say no to an opportunity, never ever say no to an opportunity. But yeah, so I jumped in and, was doing CPR on the patient for the first time. That was the first time I ever did that. And it was a lot. Like definitely heart was pounding. I was like, oh my God, like just trying not to pass out, honestly. Okay, it wasn't that crazy, but it was a lot and very physically exhausting. I remember after a while just kind of turning to someone and being like, is anyone able to take over? Just because like it's very exhausting. So it really is all hands on deck. And I learned a lot from that, got the exposure, the hands-on experience, and we brought him back that third time, but then he coded a fourth time.
Oh my
And
God.
at that point in time, the doctor called it because he wasn't looking good. 90 years old, cardiac history, is CPR numerous times, and he just like
Mhm.
wasn't responding well. So we called it, called time of death. And that was, yeah, definitely a time when what I wanted my first time performing CPR, like obviously I wanted to be able to say like, yes, I helped participate in saving the patient, but that wasn't the case, unfortunately. And it was just so sad too, because the guy was stable and it like spontaneously happened. That wasn't even why he came into the ER. But Yeah, so definitely death is a part of all kinds of medicine, especially the ER. So just something that takes time to kind of, get used to a little bit. I'm still not fully used to it. But the more exposure you get, like, it does get easier.
Yeah. So how did you, I mean, you watch somebody die. Like, how did you deal with that?
Yeah, I mean, I think when you're part of the process of saving them, you at least know, like, we really did everything we could. So I think it's hard, because I am a very emotional person. I like to connect with my patients. But I think, yeah, it just comes down to being on the healthcare side of it. How they, why things happen. You did everything you possibly could and it just did not work out. So I think even just having that knowledge brings you a lot of peace versus maybe like someone else could see someone die, but like not knowing like why it happened, or not knowing that like truly people did as much as they could. It's a little bit harder to cope with because you have a lot more questions that are unanswered. But I think, when you're on the side of like doing everything you possibly can and it just doesn't work out, you at least, can try to find some sort of peace and understanding in the fact that like you did everything you could and just unfortunately it didn't work out.
Yeah. And as you said, you're a very emotional person. And so do you think, how do I phrase this? If you, what do you think is the, in the ER, like the healthy amount of attachment where something can, like, at any moment could happen to this person, but still maintain that relationship enough where they know that you're caring for them, and you know that, and you you're connected to this person, you're trying to help them.
Yeah.
What do you think is that kind of balance? Because if something did happen
Mm.
and you basically became their friend, then that would just be so crushing to you.
Mm.
What do you think of this balance
Yeah.
kind of?
I would say, I mean, more so probably like family medicine or peds or internal medicine, where you have patients who see you like annually, let's say, and they could have seen you for a patient of yours for like 20 years, more so specialties like that. I could see how it could be extremely hard. ER, you don't usually see regulars. I mean, sometimes you do, but you just care for them during your 10-hour shift, and then like that's it. So I would say ER is actually a little bit easier to not get so attached to patients, just because like you see them for like a significantly shorter amount of time than maybe like other specialties see their patients, especially like with like regular checkups and stuff. So I mean, yeah, I think you can never, you still have to approach each patient like with everything you have. You can't really hold back at all. But I think you sit there, you listen to them, hear their stories. A lot of times patients just kind of like, definitely let them do that. Let them tell you all their symptoms, their story, and you listen and you really reassure them. You tell them, I want to help you. Like, I understand this must be so difficult. Like, let's take care of it. And you still give them like, the same level of respect and patience and understanding. And then, yeah, obviously, sometimes the outcome isn't good. I don't have too much experience with that side of it. In the ER, I think I've only seen the one person die, actually, so I don't have the most experience with that. But I do know that with every patient you still have to start off giving each patient the same level of quality care. You can't hold back a little bit, um, just so you don't get hurt in the end. But I think it's a balance, and I think you really find it just with time and with experience.
Yeah. Anyway, on a more, I guess, positive note, um, talking about more of the undergrad experience, right? What is your what are some of your tips on how to study effectively, or time management, or things like that? Because that's something a lot of people struggle with, including
Yeah.
myself. So what is your advice to those people?
Yeah, so I mean, when it comes to studying, obviously that's very personal. The one thing I notice about college as compared to high school is college is significantly more collaborative. Like in high school, I don't know, like my experience at least, there wasn't too many study groups with your one or two friends. If you had the same class, you would study together, but that was really it. But in college, like there's always study groups, even with people who you don't even know. There's just always study groups forming, even if it's just like a group chat people have to like ask questions. I would say definitely don't shy away from that. Like getting into those class group chats and like meeting people and like being able to have some sort of line of communication with another student, I think is extremely, extremely helpful, because like your professors are busy. They don't always like make things clear. They don't always respond right away to your emails. So having another student that you can, ask questions with or study with or things like that, I think is honestly like one of the best things you can do. And then the way you go about studying obviously is different for every person, but I would just highly recommend joining like, the class group chats and, not being afraid to ask questions. Let's see, what was the other part of the question you asked? Just the tips. Yeah, so I would say, there's a lot you need to do before you apply to medical school. There's a lot. All the extracurriculars. We haven't even touched on the MCAT. That's a huge part of it too. So there's a lot that you need to do before applying. So I would just highly recommend, if you're lucky enough to know going into college that you want to pursue pre-med, I really would try to start right away, at least with just little things, even if it's, your first quarter semester of college, just like join a club, and maybe look into like volunteering. Like even if it's just something small, like you really do want to start getting involved in things as early as you can, because it's a lot you're going to have to do. So you don't want it to be like junior year and you're like, oh gosh, I have no leadership experience. I have no volunteering. I am just now getting started in research, and I like haven't even started studying for the MCAT yet. And like then you'd feel very overwhelmed. So I would say for sure start getting involved in like clubs and volunteering your freshman year, maybe even like some hospital shadowing. Junior or sophomore year, maybe start looking into like some research labs, and maybe junior year take on some board positions within your clubs and volunteering. They definitely want to see leadership. And yeah, I would say just start that way you can kind of build your way up, because leadership is important too. So you want to be able to build your way up into the clubs you're at and maybe take on president or vice president or something. And then with research, like you really can't do research for just 1 year. Like you're not going to get much done. So it is nice to have like 2 or 3 years of research. And then also that way you can better map out like when you want to take your MCAT. That's like a lot of people struggle with that. It's just even finding out like when should I take my MCAT. And I planned out like from freshman year. I was like, I know exactly when I'm going to take my MCAT. I'm going to take it summer between junior and senior year. So I never like worried about that. I was able to plan around that. But other people don't think about that or start to plan for it. So then they, kind of miss maybe when they should have started studying or signing up for the exam. And then they have to like, evaluate like what they're going to do. And yeah, I would just say always try to plan ahead, even if it's like a couple years ahead. It never hurts to at least just start thinking about it and mapping things out.
Yeah, and then if something comes up that you can kind of maneuver around it, you're not always stuck with, oh my God, I signed up for this thing last minute, and like I have to, if you're in the ER, you got to go to this shift or you got to do something like that. So that's a really good advice. Yeah.
Yeah, definitely. Like I knew like, okay, this summer I have to take summer school classes, but the next summer I'll do hospital volunteering the whole summer. And then the summer after that, I'll do the MCAT. It's always good to kind of like plan, and then you can see like, oh, I have a lot of these kinds of experiences, but I still need to shadow, or I still need more community service. Like, and then you can add that on as you go rather than have to cram everything in at the end, because that can be very stressful. Lead to extra gap years than maybe what you wanted to do.
Yeah. Would you, and speaking of someone who took a gap year, would you recommend that to most people?
I really would. It's becoming way more common than not nowadays to take a gap year. I think it was really important. I know some people who literally only had like barely a month off from the time they graduated college and started med school. So a lot of people don't realize med school starts usually like end of July. It doesn't start like September like universities do. So yeah, they start pretty early. So if you go straight to it, you may only have like a month off, if even. Um, and that may not be enough time to fully recharge. So there is the relaxation part of it, but there's also the experience part of it. Like I couldn't imagine going into med school without this past year of scribing. Like already I know so much more than I would if I started last year, like significantly more. And I wouldn't trade that for anything. And scribing, you know, people like to do like research internship programs or shadow more specialties if they're just like not 100% sure like what they want to do, or like if they even want to do medicine. I think there's a lot of value in kind of working a little bit, getting more experience, maybe making some more money, because you know med school is very expensive. And yeah, I think there's always value in experience. And it is still important to prioritize, you know, relaxing and giving yourself breaks. So I really could not imagine going straight into med school with only like 1 month off since graduating college. Like this year has been really nice. And I definitely now feel ready. Like when I start med school, I'm going to be all in versus like starting off still kind of tired.
Mhm. Yeah, that's a big thing because you want to give it your all. You don't want to kind of just like half-ass it your first year because you get kind of this weird reputation, this maybe brand new place, you know? So yeah, that is something I hadn't really considered, was that they start in July and that gonna need the extra time to kind of recharge for the probably one of the biggest challenges that you'll ever face.
Yeah, absolutely. I mean, who wouldn't want to set themselves up nicely for med school, you know? A little extra money in your bank account, more knowledge from, you know, being in the clinic, and you feel so refreshed and ready to start. I mean, that's just yourself up for success, you know? But everyone's different. Some people don't want that gap year, and I totally respect that as well. I think just as time goes on, it's becoming more and more common to take it. I think the hesitation in people taking a gap year is mainly based on like societal stigma, but I think for sure that's breaking every single year that goes on, because majority of people do take the gap year. And med school is just so hard to get into nowadays too. Like you sometimes even need gap years to or experience to even just put on your application, like not just like to prepare yourself personally for med school, but even just to have on your application to get into med school. That's also extremely important. Something people don't realize is if you don't want to take a gap year, then you have to apply to med school the end of your junior year. So that means everything you do your senior year isn't even going to be on your primary application to medical school. And for me, I just knew I was doing so many amazing things my senior year at UCLA. So there's no way I'm applying to med school without these on my application. Like all three of my significant experiences were all things I did my senior year at UCLA. So
Okay. So yeah.
you
And
want to keep in mind. Yeah.
so did you applied at the end of your senior year? So this was kind of your gap. You're waiting for the decision.
Mm-hmm. Exactly. Yes, it can take the whole year to even just find out where you're going and to do like interviews and maybe tour the school. So I think I've heard some people say they're trying to change it from gap year to application year, like just like calling it application year, because like I definitely worked a lot like on my application, you know, this past year. Like over the summer, I was doing all 30 secondary applications for each individual school I applied to. And then throughout the fall and even early winter, even early spring sometimes, there's like interviews. Maybe you want to fly out and tour the school, even though the interviews are usually And then, yeah, and then after that, like I didn't find out until late that I got into Penn State. So I didn't have much time to like prepare to pack and like literally move across the country. So there's definitely like, I was not sitting around doing nothing this past year. So it's not a gap year per se. I was definitely like more of an application and preparation for medical school kind of year.
Yeah. And that must also be stressful as you're waiting the entire time for the decision of, do I have to wait another year? Can I finally go to medical school, or something like that? That's got to be, I can't imagine.
Yeah. Yeah. A lot of anxiety for sure. This process can really take a toll on your mental health. I think that's something not talked about enough. So that's why I think it's so important to always still have some hobbies, even if it's just one little thing you can do when you're stressed. I think that really goes a long way. A big support system to lean on. Like my family's always been very supportive of me pursuing this career. And then along the way, so many friends in all the clubs I've joined that like we're going on this process together. And there really is something about togetherness and just like shared trauma, so going on this process with other people just like immediately makes you feel so much better, knowing like, oh, this person who's a year ahead of me, like, yes, they said it was hard, it was so stressful, but like they're there now and they said it's worth it. That motivates you to keep going. You're like, other people you're doing it with, you can ask questions, share ideas, and even sometimes hold each other accountable too. So I think it gets hard, takes a toll on your mental health sometimes, but it's important to system both in other people and within yourself, like what you can do for yourself, and just like really hold on to that, because this past year has been very stressful for sure, but it all worked out in the end. So in hindsight, I'm like, oh, I was like stressing so much, but but it's hard.
Yeah. Do you have any, for someone who's like a little bit shyer, right? You're talking about like making your own opportunities. If someone has like a hard time going up to people and approaching them saying, can I shadow you for the day? What's your advice to them?
Yeah. So I think honestly, like I'm very social now. I don't mind going up to people and just like starting a conversation or asking if I could shadow them or, whatever it may be. But I definitely was not always like this. And that's why I really say I needed community college for growing, because in high school, I was very shy. Like I was not participating in the classrooms. I was not really involved in many activities on campus. So I was very shy. So I think I almost kind of needed that reality check of not getting into college out of high school to realize like, oh, wow, like being shy, like it's not going to work, not for this kind of career. And not that it's never not going to work, but you can't let the shyness keep you from taking opportunities that you need. Like outside of medicine, you can, be whoever you are, and that's totally fine. But like in medicine, as a physician, like you really do need to have that leadership initiative side. It's just kind of part of the job. So I would say it was, I knew I was like, okay, I need to get outside of my comfort zone and I need to do something. And it was scary. Like when I started that pre-med club, I was so scared, but that was something I was like, I know to do this. Like I kind of learned from that experience that if something scares you, sometimes it means you should do it. Not like, jumping out of an airplane or, going 100 miles per hour on the freeway, but just like that gut instinct of like, oh, wow, like, oh, it's like, it's going to be so scary to start this club. Like, what if I fail? What if no one goes up? It was just like having those scares. I realized I was like, no, like, this is a great opportunity. And these fears are like my body, I don't know, kind of like just being scared and telling me like, no, don't risk it. Don't risk it. But like, that's sometimes a sign that it's like, no, like I'm scared because it's a really great opportunity. And it's just this great opportunity is just disguised and it's making me shut down. But like when you take a deep breath and kind of push the fear to the side, you realize, no, this is something I really like want to do and should do. And I did actually start the club with one other person, my classmate. So I would say doing it with other people really helps because I was really shy, I was really scared. I wasn't sure how it was all going to work. But I had a friend of mine who was also pre-med, and we were like, you know what, let's just do it together. And, going back to that, like, you know, teamwork, is a big part of healthcare. I think that was really nice. Like we were a little
Mhm.
scared, but we knew like, okay, like if we do it together, like it's gonna be good, it's gonna work out. So I would say that was really helpful. I would say when it comes to stepping outside, when you really just have to do like baby steps by baby steps. And even if like you're doing it with someone else in the early stages, like just whatever little push you can get, like is really beneficial and it's gonna help later on. So like starting that club with her really made me be like, oh wow, like this is so cool, this is so fun, I'm so glad I did it. And yes, maybe being in the hospital, going up to doctors, asking to shadow them, like I didn't have someone else doing it with me, but I
Mhm.
now have this experience of doing something that scared me and it worked. So it just took like asking one doctor. That's first doctor, I was so scared, but like I asked them like, oh hey, could I shadow you for the day, like so scared. And they were just like so surprised and they're like, yes, absolutely, come along. And seeing that great reaction was like another, step of reassurance of like, oh wow, like don't be scared, it's okay. So it's really hard in the beginning to, you're still young, you're still new to the pre-med journey. It's really hard to, reach out for help and take those like big steps and, join, maybe really cool clubs that kind of scare you. Like it's really scary, but it's all about just taking it like, step by step, even if it's baby steps, even if it's doing it with other people, whatever you can do to just like start getting feeling uncomfortable will then make you feel more comfortable with those situations. And
Mhm.
then it just like takes off from there. And now I'm like so used to it.
Yeah, one really impactful thing I heard was say one extra sentence. Just whenever you're talking to someone, if you're like buying something, say one extra sentence to the cashier so that you can just get more confident talking to people. And maybe
Mhm.
eventually that'll turn into you being able to just randomly go up to a physician and be like, hey, I just want to, can I shadow you for the rest of the day? And they'll enthusiastically say yes, most likely. So yeah.
That's really good.
And
And that goes back to the whole just like baby steps, like it really is like I'm like everyone who knows me now is like, Maddie, you're so social, you're so extrovert. And I'm just like, oh, I wish you could have saw me like 4 or 5 years ago. Like I was the opposite. But it's just about
yeah.
taking little steps and just remembering like if you don't like if I didn't go up to this doctor, like I'd go home later today and I'd be kicking myself. I'd be so upset at myself. Like I'd regret it. So it's just like it's going to be scary for 2 seconds, but then afterwards you're going to feel so much better.
Yeah, it's like the sacrifice of like 10 seconds of being scared versus um like a week of being guilty,
Yeah,
I
like
guess.
thinking back on it. Yeah, exactly. And definitely there were times I chickened out before I actually went through with it, but once you do it, it only gets easier from there.
Mhm. Yeah, and also in medicine, like that's a big thing is you see these people that are super accomplished, but you don't see the little things that they did to get there. So someone who's had like this big practice and you didn't see that they were like quivering at starting it. They were like, oh my God, like this is the biggest thing I've ever done. Like I don't know if I'm gonna be able to do it. And then it like worked out for them. So that's
Mhm.
just
Yeah,
something to keep in mind is like even these
definitely.
like accomplished people are we're all in your shoes at some point. Yeah.
Exactly. I was just gonna say that you nailed it exactly. And that's why they want to help you out, is because it's like they know you're scared. They were scared too. It's just part of the process.
Yeah. And something else I wanted to talk about is your dilemma for medical school between Penn State and this other program. You want to talk a little bit more about that?
Yeah, so when I did my interview for Penn State, it was the only interview I had. So I was placed on the wait list actually after the interview, even though I thought it went really well. The thing with medical school, wait list is very common. a lot of waitlist movements. Like if you're put on the waitlist, it's not like when you're put on the waitlist for college and you're like, okay, like I'm not gonna get off. You know, it's like very slim chance I'm gonna get off. So you more so sometimes prepare for like not getting in. For med school, it's actually like very off the wait list because there's just, you know, so many schools, so many movement, you know, people apply to 30 schools, and if they get into 5 schools, they can only choose one, you know. So then those other 4 now have to find someone else to fill that spot. So there's a lot of wait list movement with med school. So after my interview with Penn State, I was placed on a wait list, and I was just kind of having to think like, okay, what else can I do? Like, yes, I could just reapply, but I knew like I want to do something more. Like I want to see what else is out there in terms of like what I can do to get into med school. And there are a lot of master's programs, which they're virtually similar, but basically med schools will have like 1 or 2 year programs where you take similar classes as, you know, the medical school students, or maybe you just take some, you know, higher up like biology classes that like you took in undergrad but are like more challenging. And so you take like, you know, classes within like science and medicine. And the post-bac programs usually you do to boost your GPA. So if you were like a low stat in undergrad, let's say you got like, you know, 3.1 GPA, 2.7, something on the lower side, you can do a post-bac to try to raise your GPA. So like you're proving to the med schools like, yes, I may not have done the best a couple years ago in undergrad, but like I've grown since then, and I can get my GPA in those similar classes now. So that's what people do for like an application boost if they have a low GPA. Or then like masters, sometimes schools have linkages to their master's program. So if you like get a certain GPA while in the master's program at the medical school, the next year they will accept you into that medical school. A lot of schools on the East Coast have that. So I just started looking into like what else is out there. Not that I necessarily needed like statistics boost with my application. Stats wise, I was really good, but I was still just looking into like what else is out there exciting, and expect med school to be like so hard to get into. So in the process, I got to like a handful of master's programs at like really cool schools that I was really interested in going to on the East Coast. But yeah, thankfully last minute, you know, like literally just a month ago now, Penn State reached out to me and took me off the wait list. And that was like a really cool moment and a little stressful because I'd applied to these other programs, thought I was going to do, you know, master's program at a school in New York on the East Coast, and was kind of planning for that. But then last minute, Penn State let me in, and then it was like scrambling and like, you know, a month and a half basically to, you know, find housing and figure out how am I going to get across the country, book plane tickets, you know, get, you know, all the stuff ready I needed, and even just like mentally prepare, you know, to start med school. So yeah, it's a really crazy process, this medical school journey. It's something to where nothing else in the entire world is like this. And yes, it can be stressful at times, but it can also be very exciting. And that's why I think it's just so important to have people to lean on, that you go through this together. So, you know, you can trauma bond together, and it always makes it a lot more durable for sure.
Mm. Yeah. Do you have any regrets? Anything from that you would, if you went back, what would you change, if anything?
God, that's a good question. I think I'm very lucky to be able to say I don't really have any big regrets, but I think that largely stems from the fact that I planned almost like what I wanted to do, like all 4 years of my undergrad, starting year. I was really into planning. I took this very seriously. I was like an eager pre-med. So I really planned a lot. Not that you have to be crazy like maybe I was, like definitely still enjoy your time. Enjoy your undergrad experience because it's so fun, and you are more than just a pre-med student. Like you're also a person. You deserve to have fun and enjoy life and go out with your friends. So I would say that would maybe be like my biggest regret, even though it's technically not medicine related. I would say my biggest regret is, yeah, maybe just stressing a little bit too much. And I think it took me until like maybe junior year, but mostly senior year, until I really found a good balance of like my personal life, having fun while at UCLA, but then also, of course, being studious and getting good grades, versus I would say my first couple years were more like only, caring about my grades and, never really going out and like having fun, unless maybe on rare times. But I would say for sure that's a regret. You still have to enjoy your time, and a lot of times that's how you make your friends, and that's then you make connections and you learn from people. And yeah, I would say that also helped me become more outgoing and confident and feel ready to take on this career, is because you get life experience too. There's definitely value in life experience, and even if it's just going out and like having a good time, that can help if you're shy, to kind of get outside your comfort zone a little bit. So there's definitely value in that. So I would say just regret not doing that a little bit experience.
Yeah. And that's a big pre-med thing, is they're just, or stereotype, I guess, their nose is just in the book and they don't do anything else. So it's good to know that that's something that should be considered, at least, is just make sure that you're still a person, like you said, have a life.
Absolutely. But like, of course, like, I'm not gonna lie, like, you do need, good grades, of course. Like, I'm definitely not advocating for, taking your grades to the side. For sure, you got to get good grades, but I was all about like, work hard, get good grades so you can play hard later and be like, okay, like, I have good grades in my classes right now, no upcoming exams, I'm all caught up on my homework. Okay, let's go hang out with my friends. It's like, kind of prioritize getting your work done first, so that way you don't have to worry about it and you can then be a normal person and live your life and do what you want to do.
Like you said, work hard, play hard. And also, going back, would you pick the modality of scribing that you are doing now with urgent care in the ER, or would you have rather picked something that was more specialized, or maybe even less if you're doing internal medicine, or something either very broad or very specialized? Or how would you, if you would change it at all, how would you do that?
No, I definitely am very happy I went with more general fields of medicine, like urgent care and emergency medicine. I think that's helped me learn as much as I can, across a diverse range of topics, going into med school, versus if I stayed very specialized, like if I scribe like a dermatology office or a cardiology office. Yeah, and I learn about, the cardiology, or, you don't really have like a whole derm unit in med school, but like, when I do that cardiology unit, I'll be like crushing it and probably, getting A+, top scores. But then I wouldn't really have much knowledge about the other topics. So I think it's just good, like, in terms of preparation for med school. I just really enjoyed learning about everything, and just really trying to set myself up for success as much as I can. But of course, if you're really interested in a specialty and a great position opens up, don't feel like you can't take it. Like, that's still, anything is gonna be beneficial.
Yeah, I guess that's the moral of the story, is whatever you do is just, it's gonna do you some kind of good.
Always, yeah.
Yeah. Well, thank you very much for your time. It was great talking to you.
Yeah, the time flew by fast. I hope I, was able to help anyone listening on their pre-med journey. Definitely, it's a long one, but just take it step by step. Try to plan ahead just to make things easier, but only focus on what you're currently doing at the time.
Yeah. Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.